So we start with the tracing of lateral cephalogram. For the tracing, you will need a lateral cephalogram standardized, an acetate tracing sheet, a visualizer, and the geometry box comprising of a scale, a protractor, a pencil, eraser, and to attach the tracing sheet to the lateral cephalogram, you need a sellotape. So first of all, you have to either you have to take a pre-cut tracing sheet or you have to cut it to the size and just place it slightly ahead so that you have an exposed area of cephalogram, and then the tracing sheet begins. Then you take the sellotape and just attach it here. You can put 3 registration marks on the tracing sheet so that in case you have to remove it and again place it back, you are able to place it back in the same position. One can be in the cranium and one in the vertebral region. And you can trace them back in the cephalogram also. When you start with the tracing, first what you have to trace is the outline, the soft tissue outline. If you can see, this is the soft tissue outline, very clearly visible. So you trace this soft tissue outline, the upper lip, the lower lip, till the chin. Then the next is that you have to trace the cranium. Try not removing your hand too many times because it has to be a smooth line. Then the vertebral column, the odontoid process, and the 3rd, 4th vertebra. Then the heart tissue. The anterior middle cranial fossa. We will locate the landmarks later on. You can see the outline. Then the pterygomaxillary fissure, the maxilla, the palatal plane, and then the mandible. You can see the posterior border of the ramus here, very clearly visible. The condyle, the lower border of the mandible, joining the teeth. Then the upper central incisor outline along with the root. The lower incisor outline along with the root. The first molar, upper and lower. The second premolar, upper, and second premolar, lower. This is the symphysis. So this is this orbit also you have to, the outline of the orbit you have to trace. The porion you have to trace, the machine porion. This is where the cephalostat rods are going to come. So now once we've traced this outline, I'm going to locate the points. The landmarks, the skeletal landmarks on the maxilla, mandible and the cranium. So before we do that, first be very sure about the outline. We start from the nasion. Nasion is the most anterior point in the frontonasal suture in the mid-sagittal plane. So this is the frontal and this is the nasal process. This is the frontonasal suture. The most anterior point is the nasion. So you can mark it here. Okay. Then the sella. This is the sella point. This is the geometric center of the pituitary fossa located by this visual inspection. You can see this housing and the geometric center, which is the sella. So just mark this point here. Then the porion. This is the machine porion. The topmost point of the placement of the ear rods in a cephalostat is the porion, the most superiorly positioned point of the external auditory meatus, located by using the ear rods of the cephalostat, is the porion. Orbital. This is the orbital. This is the lowest point on the inferior rim of the orbit. Then the articular. This is the articular. Let's mark it here. Orbital. Then articular. A point at the junction of the posterior border of the ramus and the inferior border of the posterior cranial base. This is the point articular. Then ANS. This is the ANS, which is the anterior nasal spine. This is the anterior tip of the sharp bony process of the maxilla at the lower margin of the anterior nasal opening. Then the subspinal or the point A. This is the point A. The most posterior midline point in the concavity between the ANS and the prostheon, which is the most inferior point on the alveolar bone overlying the maxillary incisors. So you see this deep concavity? The deepest point here is point A. Then the PNS. This is the PNS. The posterior spine of the palatine bone constituting the hard palate is the PNS. Then pterygomaxillary. The contour of the pterygomaxillary fissure. If you see this contour of the pterygomaxillary fissure formed anteriorly by the retromolar tuberosity and posteriorly by the anterior spine of the pterygoid process of the sphenoid bone. The lowest point here is the PTM point or the pterygomaxillary. And then the basion. This is the basion, the lowest point in the anterior rim of the foramen magnum. This is the basion point. So these are all the landmarks pertaining to the maxilla and the cranium. Now we go to the mandible. So this is the mandible. The point gonion. If you draw a tangent to the posterior border of the ramus and the lower border of the mandible, where these two lines meet and the angle is formed, there if you mark a point, that is the gonion point. Pogonian point. Here is the Pogonian point. The most anterior point on the chin is the Pog point or the Pogonian point. Menton point. The lowest point on the symphysial shadow of the mandible seen on lateral cephalogram is the menton. Between these two Pogonian and menton is the Nation point. Then you have supramentale or point B. The most posterior midline point in the concavity of the mandible between the most